Magandang umaga po sa lahat. We are now live. Welcome po to our Wednesday session of our Media Solution and Kapihan with Media. Today's topic is COVID-19 boosters, additional doses for A3 for adults with comorbidities. So today we have a special guest from the Philippine Heart Association, Dr. Gilbert Villela. So now, may we recognize Dr. Gilbert to please present his slides to officially start our program. Doc Gilbert, magandang umaga po.
Magandang umaga po sa inyong lahat, and magandang umaga, Hugo. Thank you for having me here. I'm really delighted to be in front of all of you. So I would like first to share my slides so that we could proceed. Can you see my slides, Hugo?
Yes, Doc, we could see your slides. Thank you.
Thank you. So again, good morning. The question is, why do we need a booster dose? Simply the best and the shortest answer is because of breakthrough infections. Good morning. I am Dr. Gilbert Villela. I'm the president of the Philippine College of Cardiology and the Deputy Executive Director for Education, Training, and Research at the Philippine Heart Center. We first start with some frequently asked questions, especially from my patients. The question is, I have a heart condition. Am I at more risk of getting COVID-19 than someone who doesn't have a heart condition? The answer is no. The infection can be caught by anyone. However, pag meron kang sakit sa puso, mas malala ang iyong symptoms ng COVID-19. Pwede ka namang mild lang, pero if you have a severe heart condition, you usually get the more severe response to the COVID infection. Now, I'd like to share this with you, the January to October 2020 mortality data against the January to October 2021 mortality data. And as you can see, the yellow arrow showed that COVID-19 deaths is number 3. Pero hindi yan ang pinakamalaking balita. Ang pinakamalaking balita at the same time period, a year ago, it was in number 15. Tumaas siya sa number 3. And look at the number 1 and number 2. Ischemic heart disease and strokes on number 2. And then also diabetes and hypertension diseases as the 4 other causes of mortality, top causes in the Philippines. You know why? Ang dami pong natakot na mga pasyenteng pumunta sa kanilang mga doktor, sa mga clinics at sa mga ospital dahil natatakot silang mahahawa ng infeksyon ng COVID. Kaya po sila umiwas. Nagtitiis po sila ng kanilang mga masasamang nararamdaman sa kanilang mga bahay. Nagtatago sila. Pati yung mga gamot, takot silang lumabas ng bahay. Minsan pag inuutusan yung mga kasama sa bahay, natatakot din pumunta sa butika kasi baka mahawa. So, a significant number of them have stopped their medications, causing all these increases in deaths. Yung po number 1, ischemic heart disease, ito po ang pinakamalalang o pinakamadalas na form ng cardiovascular disease. It went up, yung kulay blue po na line, it went up by 28%. Can you beat that in 1 year? That's too high. The next question of the patient is the risk of developing severe COVID-19 symptoms similar for all patients with a heart condition, or are there differences? The answer is no, it is similar. You get your COVID-19 infection from aerosolation of cough and speaking or singing of people who have the virus, no? Pasok po yun sa lungs ninyo and then cause inflammation and hypoxemia. Hypoxemia means low oxygen content ng blood kasi nabawasan ng functioning lung tissue kasi inflamed o namamaga ang inyong buong lungs. Pagkatapos niyan, bigla lang dahil yung, of course, natatandaan niyo po yung sikat 2 years ago na cytokine storm. Yung cytokine storm po ay isang massive hyperinflation and it is systemic. Pag sinabi mong systemic, buong katawan mo namamaga, inflamed, causing some myocarditis or pamamaga din ng heart, some heart failure sa yung heart, parang humihina siya sa pagpump, and myocardial ischemia. Pag sinabi pong ischemia, kulang sa supply ng blood ng puso mo. Why? simply because of pag meron kang severe hyperinflammation, nababarahan yung mga ugat na nagsusupply ng dugo sa puso mo. Tapos yung puso mo has to pump faster and stronger. So mas malakas ang kanyang work burden. Kulang pa ng supply because of the ongoing ischemia. Kaya all these things will predispose you to arrhythmia. Pag sinabi pong arrhythmia, irregular heartbeats which can cause a stroke or heart attack. Pwede siyang mag-heart failure, which is the worst form of heart disease, or shock, either septic shock or cardiogenic shock. Yung bumagsak po ang inyong blood pressure at nag-fail na ang inyong lungs. So sinasabi ko po dito na ang mga pasyenteng may cardiovascular risk factors like diabetes, yung matataba, malalaki ang tiyan, no? Chronic kidney disease, yung may sakit sa kidneys, tsaka hypertension, mas malala ang kanilang COVID-19 as compared to other individuals na wala po nitong mga risk factors na ito. Although may mga individuals po na pwedeng meron din sila niyan o pwedeng wala, who are also at risk for developing severe or fatal forms of the virus. Pwede po, ito may mga individuals who are immunosuppressed, yung kidney transplant or liver transplant, yung po mga pasyente may cancer na nagkikimotherapy or radiotherapy, yung po may leukemia kasalukuyan o lymphoma, no? Ito sila po yung mga pasyenteng talagang mahina ang immune system at madaling kapitan ng virus at lumalala po, hindi makalaban ng katawan niya sa virus. Meron din po mga pasyenteng may heart conditions such as heart failure, dilated cardiomyopathy. Yung pong dilated cardiomyopathy is the worst form of heart failure, or congenital heart disease, yung pong may butas sa puso. Sila po yung nakita namin ang tataas ng panganib na lumala, ma-intubate o ma-dialysis, no? Dahil sa kalalaan ng kanilang COVID-19. Our heart patients who also have diabetes or hypertension at greater risk. Well, base po sa data na nakuha namin sa China, all these things po ay living data. Ibig sabihin, nag-iiba yan araw-araw. Depende sa country or institution na inaaral yung kanilang data. O sabi po sa China, no, the significant proportion of non-survivors, yung pong hindi nakaligtas sa COVID-19, ay yung mga pasyente merong diabetes at hypertension. Hindi po namin alam kung bakit ganon. The reason remains unclear. May mga nagsasabi pong kasi itong mga taong ito ay meron ding concomitant significant cardiovascular disease or may sakit sa puso na nagpapadami yung kanilang ACE2 enzyme. Yung pong ACE2, sila po yung kinakabitan ng virus eh. So mas madali sila makapasok sa cells. But it is a theory. So ngayon po inaaral pa. Pero ito po ang talagang hindi po theory at alam na ng basa sa data. It is likely both hypertension and diabetes are prevalent in the general population in the age group of more than 70 years of age. So madaling salita, yung diabetes at hypertension, nakikita sila sa mga pasyenteng over 70 years old. So baka yung 70 ang issue, hindi yung diabetes and hypertension. Pero inaaral pa rin ho yan. So nakita po sa isang pag-aaral, malaking pag-aaral ni Li Zong out of China, Wuhan, China, na yung po mga pasyenteng may hypertension laban sa mga pasyenteng walang hypertension, ang survival probability nila ay mas mababa, lalo na po sa mga pasyenteng 70 years and over. Nakita po nila yung mga hindi daw nakasurvive ay yung older, yung merong coronary artery disease o nag-stroke na o yung hindi nakokontrol ang kanilang blood pressure. Overall, ang case fatality rate po ng COVID-19 ay 2.3%. Pero ito'y tumataas kapag may high blood ka from 2.3 to 6% pag meron ka ng hypertension. Older age, poorer blood pressure control, and cardiovascular disease can explain the observed associations between age, hypertension, and severity or death from COVID-19 infection. Ano po yung tatlong pinakamadalas na nakikita ng comorbidity sa mga pasyenteng acute respiratory distress syndrome? Ito po yung na-intubate, nakabit sa machine, parang panghinga. Well, number 1 is hypertension, followed by diabetes, and third is cardiovascular disease, which is usually an offshoot of hypertension and diabetes. No? Kapag hindi na control ng hypertension and diabetes, ang anak po nila ay cardiovascular disease o pagkakasakit sa puso. Isa sa pinakamalaking study na inaral ay yung pag-aaral ni Chatrats, published po ito sa London, out of London. Pinakita niyo po dito yung mga pasyenteng, yung survival probability ng mga pasyenteng may heart failure, may heart disease. So yung mga walang COVID-19 na may heart failure, may sakit sa puso, ito yung kanilang survival rate, yung kulay violet. Pero yung kulay orange, ito yung may heart disease, tapos nagkaroon ng COVID, mas mababa po ng significantly ang kanilang survival probability. Sa isa pong pag-aaral din po sa Amerika, no, 133,000 individuals na nagko-COVID na may sakit sa puso, halos 25% sa kanila ay namatay sa loob ng ospital. At malaking bahagi po sa kanila, yung pong kulay red, red bars, ay sila yung mga nag-dialysis, na-intubate, naggamamit ng lahat ng gamit sa ospital para lang sila mabuhay. Mas madami po sila, yung kulay pula. Yung pong violet naman yung nagkaroon ng COVID-19 pero wala silang sakit sa puso, kaya mas mababa. So, ang heart disease at saka COVID-19, pag pinagsama, it's a perfect storm. Kaya po ang sinasabi po namin sa aming mga pasyente sa heart center, magtago po muna please para maligtas ang buhay at para din hindi ma-exhaust ang healthcare workers and the healthcare system. Now, ito po ang sinasabi tungkol sa vaccination. People with heart disease and stroke and other CV disease are at a higher risk for serious complications versus those without the underlying condition. So pag may sakit po kayo sa puso o na-stroke po kayo o malaki ang puso yun dahil sa high blood o meron kayong heart failure o meron baradong ugat sa puso, chest pain ka, ang pakiusap po namin magtago po muna sapagkat kayo po yung talagang mas malala ang COVID pag kayo nakakuha. No? Kaya po sinasabi po ng American Heart Association, issue po sila ng statement that people with cardiovascular risk factors or cardiovascular disease itself must get the vaccine as soon as possible to be protected. Ito po ang key message. Now, marami pong mga statements na inilabas ang buong mundo, pero ito po sinamarize po dito. All COVID-19 vaccine trials have recruited cohorts of subjects, ibig sabihin mga tao, na merong sakit sa puso, cardiovascular disease, at merong heart failure, the worst type of heart disease, and have confirmed that vaccines are to be safe and effective in these groups. Ibig sabihin, ligtas siyang gamitin sa inyo at napaka-effective para mapigilan ang severe or critical COVID-19 disease or death from COVID-19. Merong rare cases of thromboembolism or myocarditis. Dapat tinatanggap po natin talaga yan. But we also confront the fact that there's an overwhelming evidence of survival benefits pag ikaw ay na-vaccinate. Yes, merong side effect, pero kaunti lang yan, rare. Out of millions of people, siguro mga a few hundreds to 1,000 lang ang nagkaroon ng mga yan. All patients with cardiovascular disease should receive COVID-19 vaccine. Ito po sinamarize ko na po yung mga statements all over the world. The clear benefits regarding the prevention of symptomatic SARS-CoV-2 infection and related serious, non-fatal, and fatal complications outweigh the risk of side effects, which are generally mild and short-lived, and severe complications which are exceedingly rare. So nagkaroon nga sila ng thromboembolism, nagkaroon sila ng myocarditis, pero nabuhay po sila, sandali lang po yung event na yun. Very rare po yung namatay. So do we need that third dose, that booster dose? Nakita po sa pag-aaral nitong mga Indian students in cardiology na timing of vaccination and the positivity of their COVID-19 test. This is after, yung pong kulay orange is after the first dose. Tingnan nyo, 22% pa rin ang nag-COVID after the first dose. After the second dose, 4.7% na lang. So it worked. The vaccine worked. Pero after about 6 months or so, nagkaroon na po ng 9.5% positivity sa COVID infection. Ang tawag po dyan is breakthrough infection. So what is breakthrough infection? Breakthrough infection are infections for people who are fully vaccinated. So these vaccines, again, we are confirming and volunteering the information that vaccines are not 100% effective at preventing infection. Some people who are fully vaccinated will still get COVID-19. This is called breakthrough infection. But what do we know about it? It is expected. Kasi di ba, yung pinaka-highest nga na percent effectivity ng mga vaccines natin is about 90% lang, pinaka-highest na yan. Pero it is expected na merong vaccine breakthroughs, no? But fully vaccinated people with vaccine breakthrough infection are less likely to develop serious illness than those who are unvaccinated and get COVID-19. People who get vaccine breakthrough infections, however, can also be contagious. Who is at more risk for breakthrough COVID-19? Yung pong mahihina ang immunity, no? Caused by yung diabetes, hypertension, cardiovascular disease, sakit sa puso, and stroke, and so forth and so on. And yung pong mga pasyente may cancer, may HIV, na nagkikimotherapy o radiotherapy. Kaya nga po ang sabi ng CDC sa Amerika, dapat meron kang additional or third dose. Third dose? So sabi ng mga Amerikano, I'm already vaccinated, but what if some folks think that's too big to swallow? Pero sabi ng doktor, it's a suppository. So bakit tayo kailangan mag-third dose? Kasi po, iba tayo ng response sa vaccine. Ito po ay model na ginawa po sa Amerika. Nakita po nila na yung dark blue, sila po yung healthy and younger individuals. Yung light blue ay older and immunodeficient individuals. You can see the response to the vaccine. Mabilis ang akyat and then slowly bumababa na through the months, through time, bumababa. And then pag nag-third dose, susipa ulit pataas, meaning additional protection. Hindi po lang alam yung pababa kung gaano katagal, no? Kasi wala pa pong pag-aaral. We're just at the early stage of the third booster doses. Pero tingnan nyo naman, yung line na ito, itong mga line ito, these are the levels required for protection. And every time na i-vaccinate ka, tumataas talaga ang protection mo against infection. So the reason why we need a third dose is kasi iba-iba tayo ng response sa vaccine. And aminin o hindi, maraming taong immunodeficient. Maraming taong may ibang sakit, lalo na yung mga may edad. So, anong determinants ng need mo for a third dose? Well, pag matanda ka, usually on more than 70 years. O kaya, ang hina ng resistance mo. At that moment na tinamaan ka, depende yan. Kasi may-aring napuyat ka, naghabol ka ng report mo, o nagparty ka, nalasing ka pa, and so forth and so. So, ang hina ng resistance mo the following day ay nahatching ka ng isang taong katabi mo na may COVID pa rin siya. So, kuhang-kuha mo yun ang laki ng viral load mo. O, depende sa variant ng SARS-CoV-2 na tumama sa'yo. If it's Delta, well, may problema ka ng konti. And then, time since vaccination. Kapag medyo ang tagal na ng vaccination mo, more than 6 months or so. So, medyo mababa, nag-wane na yung effectivity ng vaccine mo. Tatamaan ka talaga. And comorbidities. Kung may sakit ka sa puso, hypertension and diabetes, you need a third dose. Immunocompromised individuals are most likely unable to generate a fully protective immune response to COVID-19 vaccines, which have been approved for use sa general population. And therefore, protection against COVID-19 may be lower, as suggested by antibody studies in the immunosuppressed individuals. Kasi nga, hina na resistensya lang, hindi sila makagawa ng antibodies. Nakita po yun sa pag-aaral na ito na napublish sa New England Journal of Medicine noong August 2021. Ito po yung mga levels sila ng antibodies, no? Before the first dose, wala talaga. Before the second dose, tumaas ang konti. Before the third dose, tumaas ang konti. Pero 1 month after the third dose, talagang sumipang pataas, no? Ikita niyo rin po rin yung titers ng kanilang antibodies, tumataas talaga. So we need to have a higher titer of antibodies for protection. Yung po nakita sa mga cases na yung sa work po ni Berg's work na na-publish noong December 10, nakita po nila na yung mga kaso na nagkaroon ng yung mga tinamaan ng COVID-19 despite na sila yung na-vaccinate, mas mababa yung kanilang neutralizing antibody titers and IgG titer. So mas mababa po as compared to those mga hindi nagkaroon ng infection. So talagang we have to increase the titers. And the higher the titer, peri-infection neutralizing antibody titer, the lower is the CT value or the viral load. See, the higher the CT value, the lower the viral load. No? So pag mataas ang iyong antibody, mababa ang viral load makukuha mo. Pero pag mababa ang iyong neutralizing antibody, ang baba ng CT number mo at ang taas ng viral load mo. Inaral po ito nung at ipinablish sa JAMA sa Journal of the American Medical Association. Last month lang po ito na-publish. And ipinakita ito na yung mga pasyenteng na booster dose versus those who are not boosted, sobrang laki po ng gap nila. So talagang booster doses really improve or fight against COVID-19. And ito po naman ay isang study rin by Baron sa Israel. Protection against COVID-19 by the Pfizer BioNTech across age groups. Ito po yung more than 60, 15, 59, 40, 30, 16 to 29. As you can see, ito po yung mga guhit na ito are the rate of reduction. So habang tumatagal, the rate of reduction is increased, sustained and persistent. So the protection of those people who got boosted are sustained, whatever age you are in. Ito po naman yung graph ng mga hindi nakakuha ng booster dose. Talagang sumipa silang pataas. And so therefore, ipinakita na talagang we all need a booster dose. So most people need booster shots. While COVID-19 vaccines are effective, studies have shown some declines in vaccine effectiveness against infections over time, especially when the Delta variant was circulating widely. Sinabi po nila, everyone aged 18 and older should get a booster shot either 6 months after the initial Pfizer or Moderna series or 2 months after their initial J&J Janssen vaccine. People aged 16 to 17 may get booster dose of Pfizer at least 6 months after their initial series of vaccines. Ito po yung nakuha ko sa CDC. Is coronavirus after vaccination dangerous? Well, pinakita po dito na breakthrough coronavirus infections or breakthrough COVID can cause mild or moderate illness, but the chances of serious COVID-19 are very low kasi na-vaccinate ka na, especially for people who are not living with a chronic health condition. Kaya lang, parang medyo may sabit ka ng konti pag meron kang sakit sa puso o hypertension or diabetes. COVID-19 vaccines are very effective in keeping you from having to go to the hospital, being put on a ventilator, or dying due to severe coronavirus disease, including COVID caused by Delta coronavirus variant. Am I at risk for long COVID if I get a breakthrough coronavirus infection? At least one large study suggests that being vaccinated reduces the chance that you will end up with a lingering symptom of COVID-19, sometimes referred to as long COVID. So nakakatulong po ang vaccination against the long COVID syndrome. So, like everything else, the viruses evolve. Tayo din dapat mag-evolve din tayo. We must change our mind. We must think about our families and friends and the entire nation. It is about time you think about your neighbor. Kung ayaw mang magpa-vaccine dahil sa marami kang dahilan, think about the people whom you love na nakasama mo sa bahay, na nakakatanggap ng hininga mo. I think it is time to keep up or we all go extinct. Things that you can win in the latter of life, if you get vaccinated, you get back your love, you get back the food, your health, yung mga fiesta natin, balik ulit sila. And of course, ang pinakahihintay natin, travel. Maraming salamat po sa inyong lahat, sa inyong pakikinig.
Maraming salamat po, Doc Gilbert, for that very comprehensive presentation and for reiterating global sentiments that vaccines are safe, effective, and free for the government and for those with comorbidities. So we now move on po sa ating question and answer portion. We have a few questions here. So our first question is from Caroline Bonkin from CNN Philippines. She says, "It's been a year since we started the vaccination against COVID. Ano po ang pinakamalaking naitulong ng bakuna sa atin, especially those for the A3 population?" And a similar question po doon, bakit kailangan ng booster para sa karamdaman ng mga priority group A3? Dr. Gilbert?
Salamat sa tanong, Caroline. Actually, kitang-kita ko. Ako po ay nagtatrabaho sa heart center. At alam niyo naman, ang heart center po ang kami ang unang biktima ng COVID-19. No, we lost 2 agad. And alam niyo, after na mamatay yung dalawang doktor namin sa COVID-19, sunod-sunod na po yung mga aming residents and fellows who are training and nurses. Alam niyo ba, ang nagjo-duty po sa ospital namin ay mga radiology fellows, pathology fellows, kasi wala na kaming doktor. Naka-isolate po silang lahat. We know how bad it is. Pero alam niyo po na unang vaccine, we received our first vaccine, I think it's November 2020. Hindi ako nakatulog magdamag kasi excited po ako dahil takot at takot po ako dahil we face patients. We have to make our rounds. We have to go to the war zone itself. Kaya hindi ako nakatulog. Alauna ng alam ko yun, 1:30 na umaga gising na po ako kasi I wanted to go to the hospital ready to get vaccinated because I know the vaccine represents hope. And what happened after the vaccination? Okay, may nagpa-positive pong COVID sa amin at may mga, in fact, umabot kami sa 150 COVID patients. Hindi po kami COVID referral center dahil ang heart center is a specialized hospital para sa mga taong may sakit sa puso, and inaalagaan namin yung sanitation and cleanliness and health ng buong ospital. Pero we had 150 patients who have heart disease and COVID-19 infections. Nag-survive po sila because they were all vaccinated. So it was a very good experience for us. Even without reading the data, ang aming pong karanasan sa heart center ay nagpakita ng ebidensya na oo nga, magkaka-COVID ka, pero in a week's time, balik ka na sa bahay mo, trabaho ko na ulit. Yun po ang ginagawa namin sa fellows namin. Lahat sila, kalahati sa 50% sila, nagkasakit ng COVID nung mag-research, I think it's the September surge. Nagkasakit sila sa COVID, so naka-isolate sila lahat. Pero ako po, trabaho ko pong i-monitor sila. Wala. They're all doing fine. What are you doing? Sir, nag-aaral. Sir, nagbabasa ng book. Sir, nanonood po ng TV and so forth. So they're all fine. So yan po ang isang sa pinakamagandang dulot ng vaccination. Protection against severe disease and the probability of you dying. Do we need the COVID, the booster? Of course we do need. Kita po namin after 6 months, pababa na po yung pababa na yung antibody titer natin. Pero once you get the booster, sipa ulit sa pataas, mas mataas pa ang antibody titer kaysa sa una mong vaccination. Salamat, Caroline.
Thank you po, Dr. Gilbert. Now, we still have another question po from Caroline. Ang tanong niya po, what are the common reasons why persons with comorbidities refuse to get the booster shot?
Natatakot po sila. Natatakot po sila. Alam niyo po, yan ang pinakamalaking kalaban natin. I will admit to you, this January, February, I have a ton of work. Kasi lalo na pong February, dahil ako po ay ngayon, presidente ng PHA, ay heart month po ngayon. So ang dami ko pong ginagawa. Pero nung imbitahan po ako ng DOH to speak to all of you, tinanggap ko po. Bakit? Because you are not fake news. At kailangan po natin maglabas ng legit na news. Para kasi ang dami-dami lang pananakot na, magkakaganyan ka ika, maglalala ang sakit mo, so forth and so on. Yung fake news, yung pananakot ng mga anti-vaxxers. And some of them are also in the news. Some of them are also in the mainstream. Nakalathala, nababasa. Kaya sabi ko, paano ko kaya kukontrahin dito? Kailangan ng mga tao ng protection. Kaya I want to talk to you. Did I answer the question?
Yes po. Thank you po, Doc Gilbert, for clarifying kung bakit po natatakot ang mga taong may comorbidities. So
Fake
we really
news.
have to ramp up our drive to fight fake news and misinformation. Maraming salamat po, Doc. Now, our next question po is from Red Mendoza. Similarly po dun sa question na yon, kung bakit po natatakot ang people with comorbidities, ang tanong niya po, isa sa worry ng mga may balak magpabakuna ang myocarditis at pericarditis. Pwede po ba ma-explain ito in layman's terms yung issue ng myocarditis or pericarditis that is caused by COVID-19 virus? And why vaccines are being unjustly blamed for this? Doc?
Okay. So unang-una, ang myocarditis at pericarditis, sila po ay sa Tagalog, pamamaga ng heart. Ang ating pong puso ay isang suntok ng muscle. Ganyan siya kalaki. Puro muscle yan, kaya tumitibok yan kasi muscle. Kasi kung skin yan, hindi titibok yan. Skin Pero tumitibok siya kasi muscle siya. So ang tawag sa kanya, myo muscle. Myo is Latin for muscle. Pag tinagdagan mo ng itis, ang myo, ang card kasi is heart. Heart, muscle of the heart, itis, inflammation, namamaga siya. Bakit siya namamaga? Yung pericarditis naman, peri means around. Siya po yung cover, yung connective tissue cover ng ating puso to protect it kasi nasa gitna siya. Baka tamaan siya ng hininga mo, natuturo siya pag nasuntok ko sa dibdib. May cover ho siya. It's pericarditis. Once na tinamaan ka ng COVID-19, ang una niyang lusob sa lungs. Pero pag tama niya sa lungs, systemic na yung inflammation. Yung tinatawag po nating cytokine storm. It's in other terms, it's called hyperinflammation. Pag sinabing hyper, sobra. No, sobrang para bang OA naman na inflammation. Sobrang pamamaga ng puso mo na hindi nanghihina siya. Para bang tonsillitis is also pareho sa myocarditis. It's an itis. Di ba pag may tonsillitis ka parang hirap magsalita at saka nalalungan naman. Ganun din po yung sa myocarditis. Pero this time, it's more severe. So hindi siya makapump. Pag hindi siya makapump, kulang yung blood na pinapacirculate niya. Ano nangyayari? Nagfe-fail ang puso, which can cause death or severe cardiovascular disease. So, yun, in layman's term, ang myocarditis and pericarditis. Sometimes, pag magkaroon ka ng myocarditis, since nakadikit naman sa puso din yung pericardium o yung cover, pati siya namamaga din. So, the entire heart is inflamed, namamaga. Like, for example, may arthritis ka, namamaga ang tuhod mo, namumula at masakit. Ganun din yun. Arthritis, itis, tonsillitis, myocarditis, pericarditis. So, ang sinasabi kasi sa kanila, naku, pag nagpa-vaccine ka, sabi ng data, magkakaroon ka ng myocarditis at pericarditis. Yes, it's true. It has been seen in Europe and in South Africa. Ako po, hindi pa po ako nakakita ng Pilipinong nagkaroon ng myocarditis and pericarditis. Ilang milyon na ba yung 60 million na ang Pilipinong na vaccine natin? Parang wala pa akong nabalitang nagkaroon ng myocarditis o inadmit namin sa heart center. Dapat yan sa amin papadalhin. Specialty namin yan Wala pa po na-admit for myocarditis and pericarditis. So, although it may be true, but it is very rare. At kung titimbangin mo, alin ba ang mas matimbang? Yung proteksyon o yung panganib? Mas matimbang ang proteksyon na makukuha mo. Dahil pag tinamaan ka at may sakit ka sa puso, talagang may kalalagyan ka. Salamat sa tanong.
Maraming salamat po, Dr. Gilbert. Now, our next question naman po is from Sheila Crisostomo. Ang kanyang tanong naman po is there a vaccine brand that is contradicted with people who have heart conditions? And we have a similar question na, totoo po ba na masama ipaghalo ang COVID-19 vaccine sa may karamdaman o kondisyon?
Wala pong brand. Lahat po ng brand ay tinest. Kahit po yan ay emergency na pinalusot ng gobyerno sa atin, bakit pa nila ginawang emergency na pinalusot yung mga vaccine na yan? Kasi po, napaka-ethical po ng ating Department of Health. Kasi the usual is bago ka makabili ng tabletang ito sa mercury, dumaan mo na yan sa masusing pagsusuri ng FDA. Tapos saka lang sila mabibili sa mercury kapag na-approve na effective, hindi lang effective, safe as well. Pero ito, pandemic niya eh. Namamatay na ang mga tao eh. Alam nga namang padaan, sasabihin natin, teka muna, aralin ko muna. Baka mas maraming pang mamatay. Kaya sabi na, sige, emergency. Since meron namang theoretical basis na nakita sa ibang bansa. So, yun. So, so bago yan na-aprobahan ng emergency at saka na-aprobahan sa ibang bansa din na emergency, lahat tayo emergency. Pinag-aralan yan sa several cohorts of patients. Pag sinabing cohort, grupo ng mga pasyenteng mayroong sakit sa puso, iba-ibang type ng sakit sa puso. At nakita nila, ala namang diferensya. Okay naman. Pare-pareho po sila. At bawa, ang nakuha mong primary vaccination is Sinovac. And then nagpa-boost ka ng Pfizer o Moderna. Kahit na may hypertension kang diabetes, walang ebidensya na bawal i-mix sila. What you do get is increased protection against severe COVID-19 and death. Salamat po sa tanong.
Maraming salamat po, Dr. Gilbert, for clarifying na hindi po masama ang mga bakuna para sa may karamdaman. Now, moving on to our next question po from Aiko Miguel naman po. What are the common adverse events following immunization of people with comorbidities, especially those with heart disease? And as a follow-up to that po, what do they need to do when they experience mild AFib?
Okay. Thank you, Aiko. Actually, pare-pareho lang tayo. Common adverse, yung mabigat yung arm, na masakit, tapos para kang may trangkaso ng isang araw, pero bago ka matulog, nag-buy Jessica, nag-advertisement, nag-paracetamol ka, pag-ising mo, wala na, you're good as new. Ganun lang. So, it doesn't really, kumbaga sana, konti lang talaga yung may high blood, tsaka may diabetes na nagtagal. Pero pare-pareho lang po tayo ng reaction sa vaccines. And then, anong dapat gawin? Well, you cannot prevent the effects. Hindi po ba hindi mo siguro natatandaan. Nung maliit tayo, pag meron tayong BCG vaccine or any vaccine, nung maliit tayo, anti-measles, anti-chickenpox, nilalagdat tayo. Sabihin ng nanay mo, nilagdat ka ng 1 araw o 2 araw nung magpa-vaccine ka. Ganun din po. Nakakalagdat talaga po ang bakuna kasi it's a foreign body introduced in your system and your body will have to react to that and protect you. Pag nilagdat ka, pwede mong isipin na, good, my body is protecting me already. It is reacting. Kaya nga, ang biroon nga po namin sa ospital is, pag wala kang naramdaman, sabihin namin, naku, mukhang niloko ka, mukhang tubig ang in-inject sa'yo. Pero of course, that's a joke.
Maraming salamat po, Doc Gilbert, for clarifying that. Now, you've mentioned po earlier na dapat po sa ating mga priority population na kung hindi pa po nagpapabakuna, they should stay at home para po maproteksyonan po sila. Now, we have a question here kung gaano po ba ka-importante ang telemedicine with those with comorbidities and madami po ba ang nagpapakonsult in light of the pandemic?
Ay, oo, ang dami. Before the pandemic, hindi po ako nagte-telemedicine. Why? Because it is better that the physician sees the patient face-to-face, touch the patient, examine the patient. Pero after nung pumutok na ang COVID-19, takot sila. So anong aking unang response? If they cannot come to me, I will come to them. I will go to them. How is it? Virtually. So it is the only way that I can see them and make sure that they're safe. Parang obligasyon ko ito eh. Hindi ko sila pwedeng takbuhan at taguan. Oo nga, lahat tayo ay nanganganib. Pero dapat meron namang makikialam. So, ganun po ang idea namin na kaya kami nag-telemedicine. Dumami na po, ang sobrang dami na po ng telemedicine. But, since last December, dumadami na rin po ang face-to-face. Kumokonti na ang nagpapa-telemedicine sa akin. Mas marami na nagpupunta sa clinic. In fact, kahapon, parang balik na sa normal eh. Tambak na rin sila sa clinic. But of course, we still do practice the minimum safety protocols. So talagang merong guard doon na kine-check sila o nakababa yung face mask mo o paki-separate po ng konti. Wag nilagyan na ako ng X yung sili, inupuan nyo pa, yung ganun ba. Tapos inside the hospital, inside my clinic, bago sila pumasok sa loob ng aking office, meron pang alcohol doon, so nag-alcohol muna sila. So, well, it's just an idea to tell them na we keep them safe and we keep everyone inside the hospital safe.
Thank you, Doc Gilbert. Now, I think this is our last question if no more follow-ups question arises. So, this is a follow-up question from Lay Alves regarding po sa breakthrough infections. Ang tanong niya po, pwede po ba maging severe ang breakthrough infection sa may comorbidities kung wala silang booster?
Pwede. Technically, pwede. No, pwede silang magkaroon ng severe. Sabi ko nga, kasi kung minsan, may comorbidity ka o mas kahit na may comorbidity ka, basta may vaccine ka, may primary vaccine ka, protected ka from severe disease. Pero siyempre yun ay nakuha namin it's an epidemiological data. Ibig sabihin, nakuha namin sa study ng population. Pero individually, kung nataon na ang baba na resistensya mo, puwet ka, stress na stress ka, dahil mong ginawa sa bahay and everything. Nagtatrabaho ka sa bahay, nag-aalaga ka pa ng mga anak at pumapasok sa online, nagluluto ka pa sa kanila, naglilinis ka pa ng bahay. So you're so stressed, tapos tinatawagan ka ng opisina, pakisabi mo ng report ito, pero ang report ganyan kakapal. Stress. No? So ang hina ng resistensya mo, you still may technically do get severe disease. But the rule is, if you got the primary vaccination, and nagkaroon ka ng booster dose, hina na, tatamaan ka pero usually on mild. I had a very close encounter with a COVID-19 positive patient who is inside my house, and we eat together and do things together sa bahay, and everything. Did I get the infection? I was negative the entire time. Siya lang po ang nag-positive. So that means talagang sobrang galing po ng vaccination and of course the booster dose.
Maraming salamat po, Doc Gilbert. I think we've exhausted all questions po. Siguro just a reminder lang din po, maybe you could give your final messages po sa ating mga tagapakinig and our media partners. And siguro a reminder lang din from Red Mendoza na maybe people with heart disease can avail of free telemedicine services. Ano po ang inyong mahuling mensahe sa ating mga tagapakinig? Doc Gilbert?
Thank you so much, Hugo. Red, ang Philippine Heart Center Outpatient Department is on telemedicine. Naka-telemedicine po ang heart center. Although marami na rin yung pumupunta at pumipila sa amin face-to-face. But the telemedicine procedure is still there. Nandun pa po sila. Ngayon, what will I say to those who have heart disease and everything? Just like peace and war, health is a choice. Yes, may COVID. Yes, may gera sa Ukraine. Pero you have to choose. You have to choose what is good for you. Vaccines and booster doses have been shown to be very good for us. Why suffer? No? Bakit kailangan mong yung i-deny lahat ng truth? Sabihin mo yan ay isang pakana ng mga politika or something. Ha? Paano yung mga namatay na pasyente namin, mga namatay na doktor? Pakana lang ba yun? Hindi ko maintindihan po yun. Deaths and morbidities are so real as my two hands here. And I've seen how people suffer. Alam niyo ba kung paano magtrabaho sa ospital? Sus Maria, baka hindi po kaya ninyo. Have you seen people die alone? It is the saddest part of my job to see people die inside the room alone. Wala man lang humawak sa kamay niya na kamag-anak. I can hold their hands, but it's not the same kung asawa niyo o anak niya ang nakahawak sa kamay niya. But again, as I told you, health is a choice. Why deny yourself of freedom from disease? Get vaccinated and then get boosted. Para lang, hindi lang para sa inyo, kundi para sa mga kasama mo sa bahay na pwedeng mahawa sa iyo kapag nagkaroon ka ng COVID-19. Magandang umaga po sa inyong lahat.
Maraming salamat po, Doc Gilbert. It's a very wonderful message. Muli po, on behalf of the Department of Health, our deepest thanks for joining us here today sa aming Kapihan session. And it was a pleasure having you here. Sana makabalik po ulit tayo in future sessions. And ayun po, to our media partners and to our viewers, maraming salamat po for joining us today in this Kapihan session. We'll see you po all next week. And muli po, from the Department of Health, maraming salamat po. Keep safe.